threat messages on his phone. During the second attack, the hospital matron received a threatening call and the text messages, which have also attached a document as evidence, and I had patients were not given any right to make a choice. All had very limited choice. They were physically denied essential items like food, drugs, oxygen, and care, plus other things. Their privacy and dignity were invaded. Patients were given only 3 options. And this was real. It was 3 options, and the options were given by medical doctors known to me. And the first option was to go home. They were told either you can go home and you don't have a bill. Number 2, you can go to any other hospital of choice with no means provided. Number 3, the third choice was to go to annex hospital. During the first attack, we had a total of 22 patients. Among them were mothers who had undergone cesarean section and over 5 patients who had undergone major surgeries the same day. Among patients, we had a premature baby and a baby who had just been discharged from ICU and was on close monitoring in newborn unit. The baby was on oxygen therapy. During the second attack, we had a total of 17 patients. Among them were 2 mothers who had just had a cesarean section, a premature precious baby, 1 patient in ICU, 1 patient in HDU. We also had very critical patients who were on close monitoring. Some patients who were on oxygen opted to go home without oxygen support out of anger and frustrations. There was total disruption of care and treatment. Patients were subjected to pain and discomfort as the eviction was done in haste, and the attackers had no history of the patients. They didn't know anything about the patients. Patients who were supposed to maintain certain positions as per their care were made to sit on wheelchairs. Post-op patients, that is post-operative patients who had major surgeries patients, were put on wheelchairs. Patients who were being managed for deep venous thrombosis were discharged, that is, they were released to go home, they were made to walk, not considering the threat that was there to their life if the clot moved to the lungs. The patients could not access lab results or other diagnostic results which they were waiting for. Mothers were separated from their newborn babies, and one could hear mothers screaming for their babies. It was really chaotic. Patients who were waiting in outpatient for services were left unattended, and no triage was done. Some were left with pending diagnostic reports or treatment. The patients just left with no diagnosis, with no treatment. Some had been seen but had not received treatment, so they just left, and nobody did a follow-up. Patients who were in the process of admission were also left abandoned. Patients who were booked for procedures, for example, we had 16 dialysis patients who were booked for the following day, and 6 surgical cases which had been booked were left without a choice. No alternatives were made. Patients were not given a chance to contact their primary doctors or even relatives. By the end of the 2 attacks,